Now that we've covered all of the basics that you need to know before you get started, we can begin. So normally, what I'm going to show you is a procedure that I do for new clients, and it's a way for me to use it as a fact-finding. So the greatest thing about cups is you can think you know where the client has an issue, but until you start working with the cups and listening to them, they're going to take you places that you didn't even know the client was having issues with. So the first thing we're going to do is a trigger point maneuver. It's done without the oil. And we're going to start off by using the D cup. And the reason we're using the largest cup possible is because we're going to place this cup directly over the client's vertebrae, starting at C7, which is that large notch, as you know, in the back. I normally don't cup over the spine unless it's put on statically. But by using the D cup, it's diffusing that energy outward. So as we begin, we're going to place this cup on as strong as possible. So we haven't really discussed how to achieve those different cupping strengths. So if you take a look at this cup, there's a top ridge where you can hold, another ridge, and then the very bottom. So this is a place where you can place your hands and place the base of your palms directly on top of the little handle, or the handle of the cup. So if you draw it in, and I'm going to step out of the way so you can see, if I draw it in all the way back, that's the strongest cupping. If I draw it halfway, that's medium. And if I slightly draw it, is light or weak. The trick is when you place it, keep your fingers out from the very last ridge, because if your fingers are in there, you'll never achieve the suction. So what we're going to do now, I want you to place one of your legs behind you and use your body weight. And you can shift your body weight back and forth. So I'm going to pull this cup up to the strongest setting, place it over C7, and I want to have it right in the center of C7. Come forward with my body weight and let go. Another great way to know if this is the cups are on at the pressure that you want, this will be a little bit different. So we're going to show you this is strong cupping. You can see where it's kind of convexed into the cup. So I know that that's on strong. The cup will be placed on for about 20 seconds, just so the tissue around the cup can adjust and start to soften. Grip the cup, step back with your weight, hold for a second, and then begin to twist. So as I begin to twist this cup, it's going to stop. So I call these gates of resistance. So that's his first end gate. And if I pause, keep it in the twist and just pause, it'll open up and it allows me to go a little bit further. Take it back into center, lift, and twist the other way. But what you don't see, I'm going to take the cup off now. What you don't see, because we don't have an overhead camera, is I am looking at the tissue move on either side of the cup. And I'm feeling for areas that are restricted with that movement. So once again, you're going to observe and feel what's going on with your client. Find the halfway point. Come in, drop your edge, or bring it up, create firm suction. Drop that edge, take your fingers out of the way. Once again, 20 seconds. Lift, shift your weight back, and turn. And pause. Come back to center if you need to, if you feel like it's opened. Otherwise, after you pause, see if you can go just a little bit further. So he's very even on both sides. So you can do that, you can continue doing that all the way down to T12, and then you would stop. So that's the first procedure that you can do on your clients. Like I said, this is a fact-finding mission for me to see how tight he is. He's a little bit snug in here. I didn't feel any lopsided when I turned. He seems to be pretty even on both sides, which is really good. Anytime I use a cup, so I don't wind up having to wash my whole set, I just turn the cup upside down. Now we're going to go ahead and apply our oil. And the oil is really important. You need an oil that is water soluble. So if you're using a lot of oil when you work, it's not going to be sticking to your sheets, which can actually present a fire hazard if you have an accumulation of that oil. We want to make sure that that oil is applied liberally to the client. And be aware of the area that you're in. If it's summertime, people have been out in the sun, they're going to be a lot more dry. The oil needs to be repeated and applied. So always make sure you have a nice, smooth glide when you work. Keep a towel handy. Make sure that you wipe your hands. I can't tell you the number of times that I did not wipe my hands. I'm in a darkened room with a silicone cup, and that cup flies out of your hand, and you're trying to find that cup. It's silicone, so it bounces everywhere. So make sure you have a towel handy that you can clean your hands. Let's come in, and we will use the other silicone cups, and we're going to demonstrate all of the cups. So I'm going to come in, and I picked up 2, and you can do it on both sides evenly, or you can just do one side. But for demonstration purposes, we're just going to do the one side. Come in, and this is light to medium. So anytime you work, you want to make sure that you have anchored behind the cup. I'm coming up here. It's going to be a little bit harder for me to anchor at this point. So I'm just going to have my hand on this side, creating a little bit of tension, switch my hand. Using my body weight, watch, I'm shifting back and forth. So there is absolutely no exertion on my part whatsoever. Make sure that you lift. This is massaging, pushing down. This is cupping. Okay? These cups are great for static and for dynamic itself. So once that is finished, well, let's try another cup. I'm going to bring you to the glass cups. I need to take a look. I don't need the big one for right now. I'm going to use this one. These are the glass bulb cups. I have got a 45 in my hand. And normally before I even start working the back, I want to do what is called flash cupping or suction and release. And with suction and release, this makes it really easy. It's easier than using a cup. It goes pretty quick. But what you're doing with the suction and release, you're preparing that area. You're beginning to loosen the cup, the area, the fascia. And it depends on how tight and what's going on with your client, how much of the suction release you actually do. But these are the easiest cups for me to do the suction release on. If I have a client that has a lot of breathing issues, I'll make sure that I get the lats on the side. But he's pretty good. Got a great model here. All right. All right. Put it on its side, indicating you've used it. Okay, so now we have shown how you can do the effleurage with the silicone cup. Remember to anchor and lift. So let's come over to the I think I'll use this side. I used to make sure that your cups are always size specific. He's a little bit narrow between the shoulders. I was going to pick up the larger cup, but I want to make sure that it doesn't hit any of the bony prominences and pop off. I'm going to come in. Once again, I'm anchoring. And you can see with this wide cup, it's a nice even glide. It feels good to your client. It does not leave a lot of the cupping marks. And you notice we're getting a nice pinkening to begin on his skin. And it's going away very quickly, what indicates he's got a really nice lymphatic system. He takes good care of himself. And last but not least, for our gliding, we are going to use the polycarbonates. And we're going to go ahead and insert the small tip into this. Let's take this off. There's two sizes on the hose, a larger size and a smaller size. So on the cup gun, small hole, small size. This one, large hole, larger size. There's a little ridge on here. Do not push the green tip further than that little ridge, or you'll never get it off again. Always make sure that you check your tools, make sure that this is tightened. And then I always check it on my body to make sure I'm getting good suction. So let's take this size, and we can do the exact same thing. These are just very easy effleurage strokes. So people that really, and I've got this on just a little bit tight for my client, so I'm going to press down on the outside of the cup, reapply my pressure, and I only gave it one pump. So a half a pump to a pump is usually the weaker. And I'm going to pop to this side, give it the sidle break. So people that really like to use the polycarbonate cups, this can get in the way. So we've got different ways we can use that. You can place it around your neck. If you're right-handed, I place it on under my left side so I can use my hands, and they're free to work with the client. Otherwise, if you like to use them all day, you can put them in your oil holder just like it was a gun, and put a little hole at the end of it, and the cup is right, the gun's right there for you to use. Pull it up, grab a cup, and go for it. So it all depends on how you want to work in your practice. All right, so we're going to stay with this cup for a moment. We're going to create some more suction. So when I'm going to loosen it up just a little bit. When we were talking before about the lymphatic drainage, let's say I am done cupping his back, or if it's a client that has a lot of back edema, I may be draining it constantly. So we're just going to take that over and drop it into the axillary area. So this is lymph drainage for your client, and it's just a very, very light pump. In my personal practice, I use my hands. The clients are paying for your hands. I use my hands very lightly and just draw it into that axillary area. So if this was a client and they did not have any lymph nodes on this side, I would actually bring it over once again and drop it into the other side. Lymph nodes been removed from both sides, take it down, top of the hips, let it drain into the inguinals. Okay. So now let's look at some of the ways we can use these cups. You can come in and create some suction, and this is called rolling rotation. The cup stays in place and it's just rolling, and it's a really nice way to start breaking up those adhesions underneath the surface of the skin in a non-invasive way. We do a lot of the rolling rotations on scar tissue and on tattoos, and when we do abdominal cupping. Okay, that is rolling rotation. It can be done with the glass cup. A little bit harder with the silicone cups, but it's a great way, like I said, to break up those adhesions. The next one is going to be twisting. So let's say we're just starting to work on our client and we're gliding that cup down, and all of a sudden the cup's going to stop. It comes to a dead stop. And what it's doing, it's telling you there is an adhesion underneath the surface of that cup. So to get around that adhesion, I'm going to wipe my hands off a little bit more. To get around that adhesion, I'm twisting the cup past the point of where that adhesion is, making sure that I'm anchoring that tissue as I work. Feeling for it to let go, and then move your cup past that. Once again, the twisting action is really good if you have stubborn scarring in the body, or you have adhesions that have developed, and they usually develop right along the side of the spine, but it can be used anywhere within the body. Another great tool to use, and once again, you can do it with these cups, you can do it with the silicones, you can do it with the glass cups. The energy cups are specifically for static cupping, and so are the chakra cups. Okay? So let's say our client has ischemia in that area. I'm going to take that cup, and you're going to see how fast you can move that cup, shaking it all the while. You don't want to get the pressure too hard, tight, or you can't move past it. I'm going to move this off of here. There we go. So what you can't see from your angle, but this area is nice and warm. It's light pink, and it feels awesome. Sometimes you'll get a little petechial hemorrhaging, but that is nothing to be alarmed about. Okay. The next thing we're going to do is multi-directional. Sometimes it's very difficult to see and know how the adhesions are placing themselves underneath the surface of the skin. So for those, we're going to change our cups and put this one down. And I'm going to pick up the cup that we had used before, the Zen cup, or the dome cup, because there's different manufacturers. You can go ahead, and I'm going to go different ways with this cup. And with that nice broad base of it, it feels really good to your client. I'm doing a little circling too, and I'm going to go multi-directional. And this is a great way to loosen up any areas that are tight. And I always like to end with a few strokes of just the effleurage, taking it down once again and dumping it into the axillary areas. Scooping. Scooping is a wonderful tool for when your client has a lot of edema within their back. And I'll show you how we scoop. These are the best cups for scooping. I'm going to come in, place it right on either side of the vertebrae, and I'm going to give it a strong medium cupping. I'm going to anchor, drop my side that is closest to the vertebrae down, and as I move it to the side, can you see that nice scooping and release? So it's a great way to pick up that fluid and draw it to the side. There we go. And that can be done all up and down the back, just depending on what your client's needs are and what you're trying to achieve. All right, crossing the spine. Crossing the spine is not for every client. So if you have a client that's older and has a lot of bony prominences of their back, I do not recommend crossing the back. For other clients that don't, I like the domed, or I like the handled cups. So let's just do the dome, and we'll use a handle in a minute. Anchor. Remember, you're anchoring. he's got a little dip there. So anytime you have an area that is not even, it's not unusual that your cups pop off. Because this area is so deep, I may be limited to the amount of crossing the spine that I can do. But it's a great way to balance the client neurologically. It gets both sides, and it just sedates the body and is very pleasant for them. I'm going to a larger cup, and I think it might help. Yeah, I think we'll do better with this. Because this has a way of conforming a little bit because it does not have those rigid. Lighten it up just a little bit. Okay, Igor? Okay. So that's crossing the spine. And he's really getting nice and loose. Also, look inside your cups. When you're cupping someone through the clear cups and you see a dimple in the cup, normally that is an adhesion that is inside the area that you're working on. So not only looking at the body for the warmth and how it glides if it's stopping, but keep an eye on if you can see through the cups, see what the cups are actually telling you. So if you work in a practice in a spa and you have somebody that comes in and they don't like a lot of deep work, let your cups work for you. So I'm going to pick up that glass cup, and what I would normally do, and it didn't feel cold to my touch, but remember you want to warm those up in your hands before you start using it. You notice the client should probably not even be able to tell that I'm using a cup on them. All they're going to do is feel your hands. So your hands are anchoring as you work. And this is delicious for your clients. They absolutely love this. Can you even tell I'm using a cup? And yet I'm getting very deep. So this cup usually gets light to a little bit stronger into the mediums, not really strong. There you go. Okay. The next, we're going to open up his erectors. So if I have a client that's really tight, does a lot of lifting, I'm going to come in, and I have got my second to largest cups, always cup size appropriate, come in, simultaneously create strong suction. I've got a nice strong suction, and this time I'm going to drop to my outside edge. So I'm going to lift, and when I lift, I'm leaning back slightly, lift, drop to my outside edge. And I don't know if you can see that nice opening that we are getting into his erectors on either side. Slightly move them down by twisting, drop to my outside edge, lift, and drop into my outside edge. And you can hold 30 seconds. Come in, twist down, and you can continue down to T12 and then stop. If you want, you can even rotate them until they come back up and open them up once again on the way up. It's all up to you. You know your client, you know what they need. So since these were on a little bit longer, they did get a little bit of marking, but look how fast, if you can tell, these dissipated. He's in great shape. All right. So the last one is going to be opening of the SI joints. There's a couple of ways you can do that. I like to take the big D cup, or the largest cup that we have of the silicones, and place it directly over the SI. I'm going to lift up, and I want that on. Well, we're going to scoot these down because it's hitting the, okay. Okay. Is that okay, Igor? Okay. Always check in with your client, make sure that they're okay. And what I'm going to show you next is state approved. Not every state allows you to get up on the table with the client, even with one leg. I know in Canada you're not permitted on the table, but you know the regulations in your state. So I'm going to come up, and so I don't slip too much, I'm going to bring the sheet up a little bit. And then I can drop in, and that's not unusual, that happens. So if you feel like it's stuck, you can drop your weight into one side and apply your hand to the other and just hold, and then come back in and start working it out. It's a great way to start working on the glutes. Okay? Take your cup, pop it up, drain it off. Okay. Okay. What we have not used are these energy cups. And the energy cups, like I told you before, are rimmed with negative ions, which helps sedate any type of inflammation in the body. So let's say we've got to work on the client's upper back, and we want to start pre-treating because they're having, let's say, some sciatic issues running down their leg. Before I even get to the sciatic, I can place these cups on either side of L4 and L5, and at the top of the sacrum on the side that's actually involved, and let them sit there while I work the top part of the body. And most cups you can only leave on 3 to 5 minutes, but these can stay on up to an hour. They're easy to apply. You take it, you invert it, and the reason you're going to invert it is you want that outer rim to be completely flat against the client's body. So if I'm working sciatic, I can come up, flip it in, flip it down, place some up around their sacrum, down their glutes, and you can start pre-treating that area. So they're great to have on hand, and if the clients don't need them, they're great to use on yourself.